Did you ever wonder what happens when an individual goes through psychotherapy, or ever wonder how in the world anybody ever thought that talking about your problems would be something that could be helpful to a person? For the next few minutes, we're going to take a look at the therapies that are used in mental health practice and the theories behind those therapies. When we think about therapy, therapy involves a set of techniques that are intended to improve mental health and to decrease use of maladaptive uh, behaviors in individuals, groups, and families. The techniques used to meet these goals are based on the theories, which we'll be looking at, which underline the therapy that's being used. So today we're going to look at various types of therapy, such as psychoanalysis, psychodynamic therapy, developmental, interpersonal, cognitive, and behavioral. Please keep in mind that a therapist may use more than one type of therapy, or they may just practice one type, depending on how they were educated. Nurses with basic and advanced degrees may find some of the principles and techniques applicable to their nursing practice. First off, we're going to begin by looking at psychoanalytic theories and therapies. And this is based on Freud's theories. And you've all been through Psych 201, and so you should have some understanding of Freud, but we'll just do a quick review. Freud talked about different levels of awareness in an individual, that the person's thinking and motivations can be at a conscious level, preconscious, or unconscious levels. Now, he was the first person really to ever think about the mind in this way. And you have in front of you a picture looking at the unconscious and conscious. So a lot of what we think about and what you are doing right now, hopefully, is in your conscious mind, in your awareness. A lot of, however, of our thinking and motivations are at an unconscious level. We're not necessarily always aware of that, what's happening in that part of our mind. Freud also talked about personality structure. And he divided a personality into three parts: id, ego, and superego. And he thought that the id was based on the pleasure principle, was reflexive, that we couldn't control this necessarily. Considered it and that's another way of saying it, is a primary process. And so the ego works in so the id works with the pleasure principle, meaning I want what I want when I want it right now. Okay, it's not reality based. It's based on impulse and is considered to be irrational. The ego is the part of our personality that is a reality tester and problem solver. It allows us to overcome the id's impulsivity. And then the superego is the moral component of our personality, the shoulds. And Freud believed that conscience developed when an individual was punished for bad behavior. And that in this superego part of our personality, there's a striving for perfection, which again is not reality based. Right? The ego, acts as a mediator between the id and the superego. But typically, all parts of the personality should act together as a team. So when you're thinking about this and applying this to individuals, consider what is a person like who is driven primarily by their id. And when you think about that, a toddler perhaps should come to mind, that they don't understand waiting for something, and unless they get their instant gratification right at that moment, then they are going to throw temper tantrums, right? Which is a id kind of thing to do. A person who is driven by their superego is very into rules and always being following those rules and being perfect. Freud also talked about defense mechanisms and how those come about really as a way of managing anxiety. And in defense mechanisms, we'll cover this in more detail when we talk about anxiety, but they are used on an unconscious level, such as denial. Everybody is pretty much familiar with the defense mechanism of denial. And that's not something that a person does on a conscious level, say, I'm going to deny what's happening to me right now. No, that would be something else entirely if he was thinking and planning about ignoring something. This is on an unconscious level. And the reason for the use of denial is to falsify or distort reality just to make it less threatening as a way of easing anxiety. Again, we're going to get into defense mechanisms in a bit more detail later. So Freud's psychoanalytic theory was based on the idea that experiences during the early stages of life determine an individual's lifetime adjustment patterns and personality traits. Now, let me just say that everybody doesn't agree with Freud. And even his followers at the time learned about what he believed and then went on to develop their own ideas, such as Erikson. So what Freud was saying was that by the end of, by the time somebody was 5 or 6 years old, basically, that their personality structure was laid out, and there wasn't a whole lot to be done to help them, a person, except for them to understand their past and why they are, and then to develop an understanding of that. So he thought that since that personality was laid pretty firmly by the time the child was about 5 or 6, that the only way to help somebody who was experiencing or doing maladaptive behaviors, experiencing a lot of anxiety, etc., was to reconstruct their personality, right? And also to help them with insight development. And insight is an understanding of your behaviors and the motivations behind behaviors. So in order to help people to come to this understanding and to have this personality reconstruction done, he used several techniques. Transference was one of his ideas and he used that in therapy to help individuals. But transference is the idea that people interact with the therapist as if they were somebody in their lives, like somebody that's has authority over them. For instance, a mom or dad, right? And when that therapist-patient relationship developed, then that therapist would become, in the patient's mind, someone else. He also would use the couch. So when you see pictures of psychoanalysis, you would see a couch being used. That's pretty classic for psychoanalysis. He would talked about the identification of defense mechanisms. Going back to the couch, the whole purpose of the couch too was to help people to feel less, or to lessen inhibitions during the therapy session, so that the individual would feel open to sharing their innermost thoughts. Okay? So they weren't supposed to be looking at the therapist. The couch was to be pointed away from the therapist. Then identification of defense mechanisms, resistance to therapy, such as to therapist ideas, or in the patient, therapist might have asked the patient to bring a dream to the therapy session, and the patient forgot, with air quotes. All right, and the therapist would interpret for the patient that maybe this was a form of resistance to therapy and the therapeutic process. These were long-term weekly sessions, so this could be years, and it might be more than one time a week that the person would go there. You can see that nowadays this wouldn't work. Insurance would not pay for that kind of treatment, and people don't have time for this. The only time psychoanalysis may be used is more in a academic situation where the person maybe is learning to become a psychoanalyst, and so they would be required to complete a course of personal psychoanalysis. Dream interpretation be part of it. Childhood explorations, always going back to mom and dad and different childhood events. And free association as well. So this would be things such as, they would say black, patient would say whatever, white, tree, whatever came to mind. Just free association, again, to get to that unconscious material.